Patients with colon cancer in South Africa. South Africa currently does not have an official registry of the number of people living with cancer. However, doctors say they are tending to more patients with colon cancer than before. Cervical cancer, cervical, breast as well as testicular cancer and prostate are also amongst the most common cancers here in South Africa. South Africans are urged to get screened for various cancers to detect them early. But to take this discussion, as we said earlier on, that today is World Cancer Day. We are now joined in our studios in Johannesburg by Professor Michael Herbst, who is the head of health at the Cancer Association of South Africa. Prof, good afternoon. Thank you so much for coming through.
Good afternoon to you as well. Thank you very much for having me.
Yeah, so as I said on my introduction that there is no registry of cancer patients in South Africa, but how bad is the situation?
Look, there is a registry, but we must remember that it's pathology based. This means that only patients of whom a piece of tissue, a biopsy was taken and sent to a laboratory and confirmed by a pathologist, only they are taken up into the registry. That means that people that are diagnosed while undergoing surgery or maybe radiologically diagnosed, they're not included. Yeah. So there is definite underreporting. And we know from statistics that are available now that in 2016, just over 115,000 South Africans were diagnosed with cancer, of whom over 5,000 died as a result. That means that about 420 to 430 individuals in South Africa die every day of cancer.
But why are people still dying? Is it perhaps it's never detected on time?
Well, you know, there are various reasons why. I think one of the main reasons why is that there's a lack of access. You know, only 16% of the South African population have got health insurance. This means that they can go to a health providing organization like a private hospital and they can see an oncologist in no longer than 10 to 14 days. Whereas the majority, 80+% of the population, are dependent on the public health system. And there is just no equipment available. I receive telephone calls from people who are concerned, who phone me and say, my doctor has informed me that she believes I do have colon cancer. She referred me to a hospital in the Johannesburg area. I won't mention names of hospitals. Yeah. I was told to come back in 6 months' time.
The waiting list is too long.
And they will then tell me whether they do have capacity to see me. And that is upsetting. Now, that is within the boundaries of the developed part of South Africa. My heart, especially on a day like today with World Cancer Day, goes out to the majority of people living in remote and rural areas who don't have access to healthcare, which I believe is a human right.
No, indeed. Even those who can afford the medical, services by private hospitals, it's too expensive.
It is very expensive.
There's a lady who I spoke to this morning who was basically telling us that she had to pay 12,500 rand per session for a chemo.
That's correct. And you see, the thing is, even if you do have private insurance, you must remember that you get an allocation for oncology services. Once that is used up, you can't switch over and use some of your dental provision or physiotherapy or hospital or medicines. You can only use for oncology, and once that has been used up, you're on your own. And I have people coming into the office saying, Prof, we've sold the second family car. We're now in the process of selling the family car, and we're looking at a third bond on our house. That is the real situation, even with people who do have private insurance. And it is really problematic.
Yeah. So it's strenuous physically, emotionally, and financially as well.
Absolutely.
But you do get organizations that are, trying, like your organization. Of course, we do know there was a walk at Zoo Lake yesterday where they're trying to sort of get some funds to assist those living in the rural areas. What part do you think government can play in terms of assisting NGOs that are looking into this matter?
Well, the solution would, of course, be for government to find the necessary funding to implement NHI, National Health Insurance. But where that money is going to come from is another problem. If we look at the dire financial situation the country is in at the moment, I don't know where that money is going to come from, because it will be really billions and billions of rand, trillion rand maybe, before we will be able to really successfully implement. Because you must remember, the idea is to not only take care of the 80% of the population, but it should take care of 100% of the population. That is the ideal.
But from what I'm gathering from you, Prof, are we ever going to win this battle? Because there's a report that was recently published by Lancet which predicts that South Africa could see an increase of 78% in the number of cancer cases by 2030. So it looks like we're heading right there.
Yes, I saw that headline as well. I can just tell you that a few months ago, the World Health Organization issued a warning and said that there will be a sharp rise, but they refer to a figure of 30% within the next 10 to 15 years, the majority of which will occur in low and middle income countries. So whether it's 30% increase in South Africa or a 78% increase, it's immaterial. I don't think we will be able to cope with any of the two figures.
Prof, time constraints, we have to leave it at that. Thank you so much for coming through.
Thank you for having me.
All right, many thanks there to Professor Michael Herbst, who's the head of health at the Cancer Association of South Africa. As we said, today being World Cancer Day, and the question that we're asking you this afternoon is, do you think there's enough information on cancer? At SAToday_SABC is our Twitter handle. Would love to hear from you. Now, let's take a look